Alrighty. Well, we are here with Jackie Smith-Duggan, who is Director of Crisis Services with the Abbey Center for Community Mental Health. Um, and she has very deep roots in community healthcare. She served with Abbey Healthcare and Chatham Oaks for, I'm going to say, a few years now. Jackie, you can
Very
let them
nice.
know
Yeah.
what you want about that. But Jackie has a master's degree in social work. She's here to share with us some lessons from the GuideLink Center, really about cross-agency collaboration, which I think is a very timely subject, and has some good learning for us. So I'm just going to let Jackie take it away. But if you have questions, feel free to pop things in the chat or unmute and let us know. Thanks, Jackie.
Thanks, Ellie. Thank you very much for that introduction. I am really glad to be a part of the conversation. I was asked, the previous executive director of GuideLink has moved on from the role at the GuideLink Center to being in a new position that we are going to learn more about come July 1 when it comes to making some changes within the system. And so Abby Frenzy was the original presenter today, and she passed the baton to me. And so I'm grateful that Ellie was okay with this conversation being passed on to me as well and joining you guys today. I really do intend to make this a conversation. So when there's opportunities to ask questions, by all means, please do so, and don't hesitate to ask some clarifying questions. Some background information. Ellie's very kind. I've been with the Abbey organization since 1997, so coming up to some 7 years with the organization in different positions. I've had the privilege of kind of moving around into different roles. I've, however, consistently done is 24-hour care services. And my takeaway from that truly over the last several years is just this opportunity that we have in connecting with people for greater than an hour to touch base with what's going on and what's happening in their life. And so I'm grateful to be a part of the team with the Abbey Mental Health Center, and specifically the services that we do within GuideLink. I will also at times refer to both access centers as I provide the services. My team, the team that I'm privileged to work with, provides the services that we'll talk about today in both the GuideLink and the Linn County Access Center. So we'll talk about how GuideLink kind of redefined collaboration. I think one of the only ways in which, well, there's no I think, the only way in which GuideLink could move forward, or the access centers in the context in which we have them here in the Eastern Iowa area, is that we had to find ways to make sure that we could collaborate together on how to support the individuals that are in need of our care. We'll talk about the challenges and the lessons that we've learned from as an organization, but also across kind of the system within the agencies within GuideLink. And then our takeaway strategies, the things that we know that have been most effective, even if they are uncomfortable, they are most effective in conversations and in planning and providing services. And then we'll talk about some just final tips and takeaways. I do have a question. I'm curious if you were to use kind of one word to describe your last team meeting, what would be the word you would use?
Can't think of a good one. I've got like phrases. We just did calendar planning this morning. So we were forward thinking with a hyphen.
Oh,
So it's one
okay.
word.
It's a couple words. That works. Thanks for jumping in, Ellie. Again, part of what this conversation is meant to be is really a conversation. And so I don't necessarily want to leave people hanging without having clarification on any of the things that we talk about. And so forward thinking is a beautiful, it's fantastic that that's what you were able to do in your team meeting today, forward thinking, because sometimes we spend a lot of time talking about, the things that we're kind of stuck in and the things that we're not perhaps terribly excited about. And so what GuideLink did in terms of talking through, like, how do we bring forward thinking conversations about how we provide services, even when we don't, even when we want to do is kind of talk about the things that aren't working. And sometimes that is something that we're kind of stuck in at GuideLink. But one of the things that we continue to do is really focus on collaboration, because we know that collaboration means people receive better outcomes when there's multiple people working kind of focused together on supporting an individual at GuideLink, whether it's somebody who's coming in for just crisis services, in which they're getting crisis counseling, or they go into one of the inpatient supports. And so we know that collaboration means multiplication. We know that when we can work effectively together, we can have some positive supports that individuals can receive more, staff can receive more as a result of that collaboration as well.
Jackie, I just want to let you know in the chat too, there was stressed from Tess. And then she said, but she's feeling impacted. And then Jackie said informative. So a couple other answers there.
Very good. And all of those are true. Forward thinking, stressed, and impact. All of those are true for staff meetings. How is GuideLink different? Hopefully you guys have all heard about GuideLink and the services that we do there. If you do not, you will learn through the course of this conversation for sure. But GuideLink, located at 300 Southgate Avenue, is one of the kind of, it's unique in that it's multiple systems, multiple agencies coming together underneath one roof, but not only just being underneath one roof, really having this shared mission of how we can, again, be collectively working together to support someone that comes into our services. So GuideLink is something that came out of a conversation well over 10 years ago. And some of you on this call may be even a part of some of the conversations that started at the Johnson County System of Care well over 10 years ago. And that really identified that we saw these repeated patterns of serving the same people across several agencies at the same time. And that kind of misplaced silos that we tend to do creates gaps in care and then fragments those services for the individual. This really did spark a shared commitment of doing things differently. The question was asked, really looking at if we could do this system different, what would that look like without any of the barriers? If we could, start every conversation like that, that was the commitment that all the providers or the people who were part of that conversation said, we want to do this differently. And then as a result, from that conversation came this concept of GuideLink. Not the name necessarily that came later, but this concept of providing some different services. And so who were those providers necessarily sitting at that table of like, yes, we can commit some time and some energy and perhaps some finances into this? Really started with Johnson County Board of Supervisors. I really cannot stress the fact that the Johnson County Board of Supervisors really continued that conversation over the course of time, and then also commitment to providing the location, the building, and the managing entity and contract, which I'll talk about as well. But if you take a look at this table of organization or this structure, you can see it's layered. There's a lot of different individuals, agencies that are a part of this. And then there's some that we have other kind of contracts, or if you will, kind of agreements with, MOUs, so to speak, that maybe aren't listed on here. But really, Johnson County started that conversation and said, this is what we know what we can do in terms of providing a location, a building, and some financial support. The managing entity became a part of the next step. And so they created this managing entity agreement. Then that moves down into the Unity Point Health or Abbey Health Services, which is a part of the structure that I'm a part of. My larger organization is Unity Point Health, and then Abbey Health is my parent companies as well. Shelter House was at the table for conversation early on about recognizing and realizing that folks that are in shelter services often fall into the categories of individuals who need support associated with mental health crisis and substance use crisis as well. And so we knew in that part of that conversation was to be bringing Shelter House, continuing a part of that discussion as well. Then Community Family Resources. Prior to that, it was Prelude, and so what we call CFR now. Community Family Resources was an entity that absorbed Prelude services, but Prelude and now CFR have been at the table of conversation from the beginning. The Johnson County Ambulance Service, we're very lucky to have them in the building, providing specifically sobering support as well. They are specifically located to provide overall medical support to everybody in the building, not just to those in sobering or detox, but rather to crisis services across the um, the building. And then even if somebody isn't in services, so to speak, if somebody comes in as triage but doesn't need to go into any inpatient services, but there's something that tells us that they need a little bit more medical support, we'll call Johnson County up. And then community crisis is also there. They provide the triage and crisis counseling. And then we, the Abbey Mental Health Center, the piece that I'm a part of, we provide the professional service such as prescribers. We have 2 prescribers on site. Therapy is a part of our crisis stabilization. We have a contract for subacute services to get people into services greater than 5 days, crisis obs, and then crisis stabilization. And then, of course, we do evaluations and triage people into if they need a higher level of care. Sometimes folks come to GuideLink and realize they want us to start off with, but perhaps we're seeing more concerns associated with the service, or excuse me, their symptoms. And then overall of this is our advisory committee. We have representation, excuse me, for all of the providers in the advisory, but we have the steering committee as well. Some of the original members of the steering committee is a part of the advisory at the University of Iowa, as you can see at the bottom here. Hospital and clinics or healthcare provide support. Our Dr. Jindal is our providing medical director, and she provides that medical support on site as well, prescribed medications along with Ann Gentile Archer. So when you look at the structure, there's a lot of providers underneath one roof, but when somebody walks through the doors of GuideLink, they become a part of GuideLink services and are eligible for all the services that are in that building. There are, as a result of that, layers of things that we had to essentially work through. We don't, for example, some of the barriers we still have today, almost 5 years later, is we don't have a shared electronic health record. And that's a unique place to be when you are supporting individuals, specifically humans, to get them what they need. So we have to do a lot of great communication. That communication tends to land in some verbal communication, in addition to perhaps some emails and all that good stuff. And so we've got some innate kind of barriers that comes with that. Then we have all of the organizations with their own rules and their own licensure holdings. GuideLink itself isn't the one that holds the license to the various services that we provide in the building. Every agency provides that. And so that comes with a unique set of, we have our own board of directors we have to speak to, we have our own processes, we have compliance, we have all of these things that creates us as an agency in this building. But part of our mission really has to be compelled and focused on how we do this well at GuideLink for the individuals that walk through the door. Because when they walk through the door, they're receiving community crisis services with a triage. Triage then makes a decision about whether or not they need just crisis counseling, or they make a decision that says they need inpatient support and they come back to Abbey Mental Health Center to receive crisis stabilization. Or perhaps they started off in detox or medical job management, or what is known as detox with CFR, but then they come over to crisis services. And so the idea really was set up to be that we can provide you with the most support that does not require you to go to the emergency room or the hospital. An individual with substance use or mental health crisis can come to us. In addition to that, with the sobering unit, the idea was let's help people stay out of jails for public intox. Let's help people get connected potentially from the sobering unit. Maybe they realize they need to get a little bit more support with substance use and withdrawal symptoms that maybe we didn't know about right away. And they can just make that easy move in that same building right there. But again, comes a lot of those layering of agencies and then within the building. And then contractually meet the requirements the managing entity wants from us as well. So there's a lot of interesting conversations. So how did it start? It really started with this idea of building a foundation, that there was strategic partnerships, the individual agencies that you saw on the previous slide, but also transparency and leadership and having a shared vision. And what does that mean about transparency and leadership? One of the things that I truly did appreciate from the get-go, being one of those first providers in the building, was that we had open communication. We had to make this commitment that we could have open communication in terms of the experiences of working together, the experience of Abby Ferenzi, who was then the executive director, about sharing information. The idea was that we weren't keeping this information to ourselves, but if there was something that was going to improve the client care, we were going to be transparent about that. And then the shared vision. It really was about establishing a mission right away. What's our vision for GuideLink? And then what's the continued mission for that? Clear roles, but flexible boundaries. So the beautifulness about bringing in the different agencies was that CFR had the experience, or rather the expertise, if you will, about medical withdrawal management. Abbey Mental Health Center brought in the mental health component. Community crisis brought in de-escalation of community, of crisis service, crisis needs right away. Every agency provided some skill set, but we wanted and needed people to be flexible about how they might share that skill set in the building for everyone. And then community collaboration. Nothing can be done at GuideLink without that community connection. One of the other really cool things that happens is that NAMI peer support comes in daily. I'm fairly certain to really bring that presence of peers into the building. And in addition to Shelter House, we have regular connections and contacts because we share the same clients. And then this idea and this construct of team before agency and creating that culture shift. Of these 5 bullet points, I'm curious if someone would share out, whether it be in the chat or vocally, which of these 5 bullet points do you think, and it can be more than one, but which do you think was the most challenging to work with at different times, or continues to have some different challenges today? Of those 5, the partnerships, transparency and leadership and shared vision, clear roles, but flexible boundaries, was it community collaboration, team before agency, and creating a culture shift? What do you think has had us kind of caught up a time or two in some difficult conversations? What would you guess? Your guess wouldn't be wrong. It's certainly can be any of these things, but what stands out to you the most, you think?
Jackie said in the chat, strategic partnerships.
Okay. All right. Other thoughts?
My initial thought is team before agency. I think that's a hard one to just get over, especially right away.
Yeah. Yeah. Those are very good thoughts. Really, it was these 2 areas of transparency and leadership and that shared vision. And that kind of goes back to having strategic partnership in terms of who's in the building, but also our partnership outside, the community partnership, and then the team before agency, and creating that culture shift. It's really one of those consistent areas. These 2 are the consistent areas that we have to continue to kind of hold ourselves accountable to. It doesn't come without its challenges. There's some, not only are there philosophical differences, there's agency differences. And even if we're underneath the same building, it doesn't mean, and really providing support to the same people in many ways doesn't mean it doesn't come without different opinions about how to do that. And so when talking with our team members about this setting, or when we're talking as a larger leadership, is again going back to that shared vision. Are we on the same? Does this align with our shared vision? We have to continue to come back to that at times, because we know that there's times that creeps up a little bit. What I will say is that the leadership from the executive director down to the agencies, is looking at how do we continue to push those ourselves to maintain that continued culture of, we're one larger organization, essentially with small agencies within it, and kind of letting go of our own, being humble in that discussions at various times. So we know that collaboration can be complex. It sounds good in theory, and in practice it's good. But getting there can be very, very challenging. And so it's not just about working together. It's really about working together in terms of truly understanding that this is what our process is going to be, and how this, while it might impact my structure, like my workflows, or our, not necessarily our policies, but rather our agency specific policies and our licensure policies. And we're immediately thinking about how does that fit in versus how it doesn't fit is really an important part of our discussion. But turf battles, communication gaps happen, funding silos, although that will be changing here in July 1 for SUD services and substance use, or I'm sorry, and mental health services. But the biggest thing comes, like, we all agree to collaborate as long as it's done our way, my way, and really kind of checking ourselves. And that really comes down to building trust with each other as agencies. And that's vulnerable to build sometimes this level of trust that I can be transparent. And then there's also those responsibilities that we have about how transparent we can be within our own organizations. Here are some necessary skills that we know that we have to look at with our team members, but certainly specifically with our leadership, because we know that it's a lot easier to say something than it is to actually do something. So we want to make sure that our leaders are open-minded. We know that we're going to have some different opinions, and our experiences lend our opinions, we have to take a moment back to step back and recognize that. Our communication has to be clear and consistent. We have, and I give a great deal of credit to the supervisor of administrative services there on site, has created a very clear way that we can do this communication through a hub that allows us to do not client information, but to do specific information about things that we need to know within the building, so that there's not missed communication. Healthy debates. I know that sometimes we don't see healthy debates. We see just arguments happening outside of our businesses at a local and national level that are not healthy debates, but rather pointing fingers. And so one of the things that, again, that shared vision is about finding different ways that we can know that we can have these conversations and kind of challenge against each other. Workload delegation and organization. It's still a building that needs to be, it's managed by the Abbey Health Organization in terms of, who do we have cleaning the building, who's preparing the meals, those sort of things. But there's other, workload responsibilities. We want to make sure that there is a shared workload, no matter what agency's in that building, about taking care of the individual. This holistic understanding, the ability to anticipate outcomes, and another critical component of collaborating well. So when we might be bringing someone who might have some complex needs into either part of our building, we're looking at how this impacts the whole building, or how we can support the individual while also supporting the entire individuals in the building. In addition to being able to look at projects, understand when we bring people in, staff-wise and leadership-wise, we want to make sure that they understand the mission and values that we've established also within the access centers. And then adaptability. Nothing we can do. I think in the first year, Abby said frequently, this is what the policy was yesterday, or procedure was yesterday, or an hour ago, and this is what it is today. Or tomorrow we're going to do something entirely different, or create some different opportunities. And so knowing that we can be adaptable, every agency has to be able to be adaptable to that. Some feedback in terms of just even from individual staff really was, it's not collaboration. These were some of the things that frontline staff communicated to us. It's not collaboration if you're just co-located. And so one of the things that was done structurally for the building was we have a shared workstation between CFR and Abbey Mental Health Center. And so we have detox nurses on just one end of the workstation, and we have Abbey Mental Health Center on the other end of the workstation for crisis services. And by definition, we're co-located. But really what it comes down to is that, and why GuideLink was an important part of this, was that we could have some conversations about seeing certain symptoms that perhaps crisis would talk with detox staff about, not specifically to sharing and violating full HIPAA, but rather collaborating specifically on, here's some things that the individual said, we're thinking that they need an ASAM, and making those arrangements with CFR as a possibility and starting that conversation with the client. So again, not just about being co-located, but being able to kind of work together and lean on each other's skills. Relationships are stronger than protocols. It is vital that we have a good working relationship with every agency and the agency team members in the building. Otherwise, you know what poor relationships can do in your own department and your own team. Imagine that throughout the course of an entire building if we're not jiving together. And again, we're not going to always do that. We knew that we weren't going to always do that. And so that we spent a lot of time having collaborative staff meetings, spent a lot of time having some combined trainings together, and so that people would get to know each other, whether it's first, second, or third shift, because again, 24-hour care. We want to normalize that mistakes will happen and that it's okay, as long as nobody, of course, is hurt. But that mistakes aren't polarized as being, see, this agency did this, but rather, here's something that we're going to take away and learn from this. And then every week we come back to that discussion and kind of work through what might have been some errors along the way, and how might we do that differently in the future. And then celebrate shared wins. I absolutely appreciate the small stuff that we do that creates some great outcomes for individuals, as simple as helping someone get their clothes laundered. I mean, it really doesn't feel like a lot, but having someone take a shower for the first time in, 3 weeks, those are things that we're collectively very excited about when individuals can feel comfortable doing that at GuideLink, but also in terms of the number of people that we might have served in one day, and celebrating people's completion of their certifications or license in terms of the staff. And so there's just a lot of things that we want to make sure that we're spending time really providing excitement around the things that people know that they're doing well. Some other things is this commitment to each other and defining those mission objectives, and revisit this frequently. We have leadership meetings every Tuesday, and it isn't just a process of reviewing things, but rather very specifically, we want to make sure that we're touching base on clients that we might be serving, agencies that we want to kind of introduce to GuideLink, but being able to work toward that same mission of serving individuals differently. Consistent communication, not only within our immediate team, but in that interagency team. I talked about that we do the training, making sure that we have the right tools in order to perform our jobs, removing barriers when they exist. People refer to me as that I have Jackie questions, and I don't think that's a bad thing. I think that's a good thing. I ask a lot of questions to understand, but in the process of that, I'm trying to understand why we might create our own barriers to that process versus finding the alternative way to do it. Like, why did we have to do it this way? And what's our old practices that can be looked at in the future? And so even though my team might refer to them as Jackie questions with some sarcasm, I lovingly accept that reality, because we need to be able to look at what are the barriers. And then looking at those frontline leaders and change makers, want to make a commitment when we have team members that really embody the reasons why we're there and providing the services in the manner that we are, building them up and building all of our team members up to be those change makers. That just because we've done it this way doesn't mean we can't do it differently, even at GuideLink. Some other practical takeaways for your consideration is to build that shared mission. I think that's probably one of the first things. If we're not all on the same page, then we won't ever be on the same page. Making sure that you have some communication channels. We do daily huddles every day. When we're working with clients that we're going to connect to another program within the building, we do a warm handoff so a client doesn't have to repeat their story 1,000 times over. We develop shared workflows. So it starts this way when somebody comes into sobering. If they come in through the door and go through triage, that we're clear about what those processes are. And we're constantly, even just this morning, part of our conversation, while you were having forward thinking conversations, Ellie, I was having like, oh, this workflow isn't working the way that we had hoped it would. And so making some immediate changes to what that workflow is in order to not negate or slow the process down. Committing to cross training. Believe it or not, we have not fully done this. And I am coming back to this conversation with the full leadership, is that cross training in each department agency. We started to do that, but we've kind of shied away from it in the last few years. And so cross training to understand sometimes that reference of understanding like what that process looks like when somebody comes into sobering or comes into triage or goes into detox, to understand what that process looks like for a client can only better support us in understanding what that looks like for the staff and the client. And then start small and scale collaboration. We're not going to jump in and kumbaya around the fire pit with s'mores, making s'mores by any stretch of the imagination. But we're going to start with those discussions, and we're going to start figuring out some things that are uncomfortable right away so that we can continue to build up on that collaboration. Here's why it matters. It's because the secret sauce of collaboration. When you look at this comprehensive report from February of 2021 to March of 2025, we don't have our numbers back yet for this last quarter for all of the services, but that means since February of 2021, we have encountered almost 8,000 people. By now, we have met with over 8,000 people in terms of encounters. This has led to a total of 6,289 admissions to one of the GuideLink Center programs. And this is kind of a breakdown to what that looks like across crisis stabilization, which is a part of the services that I provide, medically medically monitored withdrawal, which is detox, and then sobering. We were just talking in our leadership meeting that in the month of May, they had the most clients that served in sobering, or excuse me, it was May. 80 people were served in sobering services, which also means that 80 people didn't go to jail. 80 people were monitored safely for withdrawal, or sobered up safely, excuse me, and maybe moved into withdrawal services or crisis stabilization. And then this kind of breaks down a little bit more about what walk-ins, who our referrals were, individuals hearing about us. We know that the best marketing is the individuals that receive the services from us and tell other people about it. Healthcare providers making referrals to us, law enforcement, while they're not in the building as a entity that's there every day, they come frequently and provide individuals to get support versus taking them to the hospital perhaps, or taking them to jail, which is exactly what we want to see. Mobile crisis, community support services. And the Johnson County ambulance can actually now bring people to us with their ambulance. And that was the result of advocacy and law changes, legislative changes last year. So if it's determined that's across any across the state of Iowa, any ambulance service that can take and transport and get reimbursed for the services through Medicaid, if they transport somebody to the access centers. Continuation of that secret sauce is that we serve more people. So collaboration is multiplication. And so this really shows where folks are coming to us from. It's not just here in the Eastern Iowa area, but certainly across the state of Iowa. The beauty of Iowa City, of course, is that there's the University of Iowa, and there's we're rich in resources in a variety of different ways. And so folks come to us from across the state of Iowa as well. Here's a success story. And this was just a recent discussion that a client, actually, I received yesterday a Facebook message from a former client who said, I know that I can't communicate to you, or you can't acknowledge my message essentially on Facebook Messenger. But he said, I came into sobering. It was my third time. And I didn't want any other services, but this last time I decided to go into detox. From detox, they talked with me about not only my SUD services, but talked about my mental health needs. I decided to accept the crisis residential services. And then I was referred to a provider, in which case I started back on medications. I was able to make referrals or get referrals or connections in real time with other community services and ongoing therapy. And then I discharged to residential treatment. The client contacted us 3 months later and 6 months, and then 1 year later indicating they were still sober and receiving services and had what he referred to as his life back. And so again, he sent me a Facebook message just yesterday saying he's still doing really well. And I know that makes all of the things and the stepping stones to get to where we are today at the end absolutely worth it. So final thoughts: collaboration is intentional. We have to be on purpose collaborating and constantly evolving. We must have these shared outcomes and require that shared effort. And then being able to take ideas back to our team consistently. That is the end, with about 20 minutes to spare, a little less than 20 minutes. So if there's questions about anything that I shared today, I'm open to any questions, any thoughts. Ellie?
Thank you so much, Jackie. If anyone has questions for Jackie and you want to unmute and ask or throw it in the chat, we'll give you just a minute here to do that. I have one question while other folks are thinking of theirs, Jackie. Do you know the reason for the name GuideLink Center? Where did that come from?
Yeah, so I wasn't a part of the steering committee conversations initially, but this is what I learned shortly after they decided, is that the idea was to guide and link services for individuals. And so walking beside someone and linking them to services. And so not leading, but rather guiding and getting them connected. And so that's where GuideLink came from.
I love that.
Great question.
Any other questions for Jackie? She summed up 10 years worth of work in about an hour.
I'm curious about kind of some thoughts about people's experiences of collaboration, just in all of the settings that you may either work or just professionally, but also professionally, but also personally. Like, what's your takeaways about collaboration?
I will just say, I think sometimes it's challenging for everyone to feel like they are getting full benefit of a collaboration. But the other thing I will say is that I have to go to another meeting to collaborate with some of my team members about some grant stuff. So I appreciate this very much.
Thank you, Jackie.
Jackie.
All right. Have a great
See
day.
you. Good stuff. Well, I would say, Jackie, I wrote down when you were talking your quote, it's not collaboration if you're just co-located. I love that because I think in our perspective, it's not necessarily co-location, but the idea of like, if you stick our logo on it, we're collaborating, which is not the same thing. And so I liked kind of thinking of that and this idea like we have to get beyond that, even if it's a small thing, even if it's a 1 hour event, even if it's, something little, because that is how we build those relationships for future collaborations and future needs, which I think are
Yeah,
coming. So
no, that's a great point. Just because your logo's on there doesn't mean that we're actually collaborating. Absolutely. And again, I can't stress that it's not without its challenges, as Jackie had indicated, and making sure that you feel like that equally people are getting, agencies and individuals are getting what they need out of that collaboration. What I do know is that there are times that you have to give and take in this process. And I think that's where that healthy discussion and transparency has to come into play. And again, I say healthy because I think it's healthy to have disagreements and it's healthy to have solutions from those conversations. And so, yeah, it's not without its wounds, if you will, without its bruises here and there.
but you did mention often too, this idea of keeping the client in mind and why are we all here? We're all here for the same reason. And we get down to it, we just have different ways of getting there. So
Come back to the mission, come back to the reason why. Yep.
super. All right. Well, thank you so much, Jackie. We so appreciate it. Couple of things from the CFJC just to let you know what's going on in our world. We have book club, TBD on date and location. We're still working that out. But here at the end of summer, we will meet. We're reading Mountains Beyond Mountains by Tracy Kidder. Tracy was an Iowa Writing Workshop alum, so he's been around. He knows Iowa City, which is kind of fun. But Mountains Beyond Mountains is about Dr. Paul Farmer. So check that one out. It's really interesting. And we'll have a discussion in person about that book at the end of the summer. June 28th is Iowa City Downtown District's block party. And I'm super excited. We have contracted with an artist in collaboration with Think Iowa City and the Downtown District and the City of Iowa City to do a community mural. And that mural is going to have some community engagement pieces as well during the block party. So come down and see us. We will be painting on a wall and you can be part of it, which is pretty fun. And then July 9th, we have a peer group at 9 a.m. We are focused on donor retention and engagement strategies. And then July 16th, we have another ed session. This one's going to be Nonprofit Advocacy 101 with Paul Thielen from the Larned Waterman Center. So lots of good things coming up this summer. Let us know if you have things going on, and we hope to see you around.